Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you're new or regular viewer that has not yet subscribed, please make sure you do subscribe, especially if you're benefiting or you really like the content that I create. This is the best way you can share your support. This is the best way you can showcase that you also support my content. Please do subscribe. It will mean a world to me. For today's video, I want to share with you two important things that, in my opinion, anybody who claims to be gender therapist or a gender specialist, especially, has to deliver on. Right now, especially, there's so many people who are claiming to be gender therapist and gender specialist, and again and again, I can't help but see people come into my office who have spent many months, many years even, with somebody who claimed to be gender therapist or gender specialist, not getting anywhere, spending a lot of time, spending a lot of money, and getting very frustrated. And I don't want that to happen to you. So these are going to be two things that, in my opinion, are a must. Now, of course, this is just my opinion, so take it as you wish. For starters, what the heck is a gender specialist? Because guess what? The word gender specialist is not necessarily regulated. It's not as if you can go and get a license and become a licensed gender specialist. In my professional opinion, somebody who has been worked close to 2 decades with only transgender and non-binary adults, for me, a gender specialist is somebody who has devoted enough time, not 1 year, not 2 years, not even 5 years, in the very least, perhaps 10 years of working either exclusively with transgender or non binary folks or primarily with transgender and non binary folks. What makes somebody specialized is not that they use the word specialist, but how many years they have spent and how many individuals with gender issues, how many manifestations of gender dysphoria they worked with. The word specialist is just like anybody else who claims to be specialist. You going and you see somebody who is specializes in oncology. What do you expect from somebody who specializes in oncology? Chances are you're expecting a medical doctor who had enough experience under their belt of experiencing with people with different type of cancers where they are so specialized they understand different variations of cancers and treatments and whatnot. Not to mention, even within oncology, there's further specialists, right? So I think it's important to first and foremost just think about what the word specialist means, right? Because sure, we live in a world, so many things are unregulated, and anybody can really call themselves specialist left and right. But in my opinion, you have to show, proof is in the pudding. You have to show something for it. You have to have dedicated years of experience. So, as somebody who I call myself gender specialist, and I'm not shy away from using the term, and I use it. I apologize. The byproduct of having bangs is that you have hair getting in your eyes, and it's uncomfortable sometimes. I use the word gender specialist with a lot of pride because that's all I do, and that's all I've been doing for almost 20 years. I feel like I earned that label, and I feel that I have lived up to that label. And somebody who I feel has lived up to that label, let me share with you two things, in my opinion, somebody who claims to be specialist has to do. Before I say that, specialists of any kind in any profession are often going to cost you more than generalists. And because they're going to cost you more than generalists, is primarily, in my opinion, the reason why specialists have to charge more is because they deliver more of value and they give you value back in a shorter period of time than you would have gotten at the same value, if at all, with a generalist. The reason I'm saying this is because this is why these two things are a must, in my opinion, especially because every specialist I know charges a valuable exchange in a dollar amount any currency amount because they have to deliver on that. The first thing the specialist, in my opinion, gender specialist has to deliver on is they have to give you a clarity. They have to give you clarity in regards to what concerns you have about gender identity, gender role, gender expression, how your sexuality plays into it or not, gender dysphoria, the acuteness, root causes. They have to give you clarity. What does it mean they have to give you clarity? It means that a specialist should not be sitting back and listening to you. And when you ask them, do you think this sounds like I'm leaning more toward non-binary identity? For them to say, that's up for you to decide. Now, yes, identity is a subjective, it's for you, you need to figure out for yourself. But specialists are there for a reason. Now, it's not that they have to tell you who you are, but based on the experience, they should be able, in the very least, to tell you, based on the information you provided me with today, or over the course of our sessions, and based on my expertise, here's what it looks like to me. And here's why. The most important, they have to explain to you why they think what they do, right? So that way it makes sense to you. They have to give you clarity if you are unsure what your root cause, or if you're unsure if this is gender dysphoria. Based on your narratives, they should be able to give you some sense of clarity. Now, clarity doesn't have to be completely conclusive and decisive, because sometimes clients will come and they will give information that doesn't warrant enough to give clarity. I had those clients where they just want one session with me, but their information is not conclusive. And I tell them, look, based on what you've given me today, here's what I think your stand. And for you to get more clarity, here's what I recommend for you to do. But they have to give you something. They have to, again, you're seeing a specialist, right? It's just like you go to a specialist, medical specialist with some symptomology, and you explain your symptom. They have to at least either give you steps to gain more clarity, or they have to give you some kind of, share with you some kind of guidance and information. For a lot of you, clarity is very important. If somebody can't tell you, oh yeah, this definitely, from my experience, sounds very much like gender dysphoria, or based on my experience, it sounds like you have gender dysphoria that you're still not fully in touch with, because there's a big part of you that is still in repression, or based on my experience, what you're sharing is that it's lesser of a gender dysphoria and more the discomfort you feel with A, B, C, D. All of those things are really important. So clarity is number one. And also, I don't believe that somebody who is very specialist has to spend a year with you to derive the clarity. To me, that's just, personally, to me, that's an insane amount of time. The second thing, in my opinion, that they have to deliver on, they have to give you guidance. Yes, mental health providers are not supposed to tell you what to do. I agree with that. We're not supposed to tell you, you should definitely go through gender transition, or you're going to regret if you don't. But they have to also be in position, because if you're seeing specialists, talking about specialists, to be able to give you some kind of guidance, some kind of parameters to branch into. For example, what could a guidance look like? When I work with people, and for example, a person comes in and say, can you, I really need confirmation. Is this really what I think is going on? We work, yes, this is what's going on. Okay, now, based on my circumstances and things, will it benefit me to go through gender transition? It is, as a professional, as a specialist, it is also my job to assess all of your circumstances, assess not only your circumstances, your access to resources, your goals, your severity of dysphoria, and your psychological makeup, and then to give you at least a few options. Okay, so based on everything you shared, if you ever going to feel a need, if you ever going to feel like you would like to step forward into gender transition, Here's what it might look like for you. The alternative option is to take things in this way. An alternative other option, if you don't want to do anything, here's some of the ways you can cope with it. This is guidance. You can call it advice. But I'm giving a person, a specialist, in my opinion, has to give something tangible, some tangible avenues of solution. Now, very different again from somebody telling you, you really need to do this, right? It's just like you see a specialist. You see a specialist and they will have a discussion with you based on what's happening, giving on your circumstances and where you're at and what you're presenting with. The best option for you is this. And if you don't do this option, here's what I see how it might play out for you. That's what specialists do. We live in a world where there's this, I feel, being articulated inaccurately is that a gender affirming therapist, which I am, I'm gender affirming therapist, right? The word gender affirming, it's, I have to affirm whatever you think your gender is. In my opinion, that is an inaccurate way to look at it. Now, gender therapists, gender specialists especially, are there for a reason to help you discern what is what. Yes, I had people who I worked with who, this is incredibly rare, who would have a strong feel about particular ways they feel and relate to their gender, but there also would be something significantly strong going on that may take them in a different direction. Again, that's very rare. But my job, in my opinion, is not necessarily affirm everything you're feeling, because you might be feeling a lot of things. And in my experience, those feelings may or may not be all telling the same story. My job is to give you information, to ask you, most importantly, questions stemming from my experience to help you then have more clarity about why and what you feel. So then, when you yourself get to the point where you feel like, oh, this is definitely my gender identity, you're not questioning it anymore because you have gone through steps, through sequence of inner analysis to understand where is it coming from. And in that case, I absolutely, of course, I support you 1,000%. Of course, I have a lot of clients come in who say, I had gender dysphoria all my life, Dr. Z. I know for a fact that the only gender identity I feel comfortable with, and that is my soul, is a trans woman. And I'm at this point where I just need to figure out which steps to take. I'm not going to be here sitting and not affirming your identity, right? I'll still do my own gender assessment, gender dysphoric assessment, because that's just part of my work, that's just part of what I do. But I will help you figure out what steps are the best steps for you to take. So again, when you're working with somebody who claims to be gender specialist or gender therapist, they have to give you clarity, even if it's clarity based on only limited information you shared in one session. And that clarity, again, doesn't have to be conclusive. And if they're professionals, they have to say, just this is based on what you shared with me. And this may change as a lot of things for you may come to the surface. That's what the responsible thing to do. But some kind of clarity, right? Otherwise, why are you coming to a specialist? They can't give you any clarity who you're seeing then and give you some form of guidance, some form of navigation, some form of, based on my experience of people who experience your level of distress, here's what benefited them. What do you think? Is this something you would be interested in? Give you those options, give you those avenues, right? Those things are very important. And if you're working with somebody who not only calls themselves a gender specialist, but also churches the value that specialists often do church, it's important to get those things, right? It's a value exchange. You are exchanging you hard-earned money and they're exchanging their hard-earned years of expertise. This is also why they cost so much, is because it's years of knowledge and expertise that you're getting all bundled up in a single session or however how many sessions you want to get. So those things are very, very important. Now, we live in a world where for some reason people, there's we live in a world where therapy just in general has sometimes can be either passive or active, right? So passive therapeutic approaches are more, as a therapist, going to say very, very little. You talk and talk and talk and talk and talk. And by talking, you are stepping into your own analysis of your own narrative, where you then come to your own aha moments. And then there's a more active form of therapeutic approach. I'm definitely a more inactive one, where um, I won't just let you talk and talk and talk. I will be asking you questions that will help you derive at the answers quicker or help you get those aha moments quicker. And I think today, especially when it comes to religion, to questions related to gender, there's so many people who really tormented by anxiety and tormented by um, just this inner confusion and uncertainty that a lot of people need a sense of figuring things out. It doesn't mean that people have to rush into things. I'm actually anti-rushing into things. If you know my content at all, I'm all about baby steps. But I think it is important to at least get that clarity and not get that clarity after 2 years of therapy. That's 2 years also of tormenting yourself of not knowing. A lot of times, just by knowing what's really going on is incredibly helpful because then you can say, okay, I know what's going on. And right now, maybe I'm not fully ready to deal with it, or maybe I'm just ready to deal it in a very small amounts. And you can pack it away and put it away and focus on other things in your life. Also, very, very important. But those are the two very important things that, in my opinion, gender specialist needs to deliver on. I understand that some people may disagree with this. I understand some specialists may say that's not how they work. That's, like I said, this is just solely my opinion. Obviously, opinion in the end of the day is just an opinion, right? This is not like written in a stone. I just personally get a little bit more frustrated when I see people who come to work with me who are very frustrated themselves because they spent a lot of time and they didn't get anywhere. And it's frustrating, it's frustrating to be in the dark for a very long period of time. So comment below, let me know what was your experience like working with somebody who called himself as a gender specialist. There's so many of you who work with people who are not even specialized and get clarity, which is wonderful. Or work with people who are not specialists but are very supportive and ask you a lot of very open-ended questions that lead you to get clarity quicker. That is also wonderful. Again, you don't need to work with a gender specialist in order to get the support you need. Therapy is not even mandatory. You may not even have access to a gender specialist. I'm just saying that for people who do claim specifically to have that years of expertise and experience, this is what, in my opinion, they have to deliver on. So comment below, share. Love reading all of your comments, and I will see you all next time. Goodbye.